Welcome to Mental Health Matters. I'm Barbara Myers. On today's show, we're going to be talking about alternative medicine. We're very pleased and honored to have two guests here that are going to share their stories with you. First, I'd like to introduce Beth Lujan Martinez, who is an educator, a consultant, and a medical researcher who teaches Qigong. And she's the creator of something called Spirit Walking Aqua Qi, which we'll be discussing a little bit later. And she has various wellness practices in various different roles in various community organizations here in the San Francisco Bay Area. And she has personally benefited from these practices in her life, and we'll be able to talk to her about the story. And welcome, Beth.
Thank you so much.
Our second guest is Dr. Michael Kessler, who is a chiropractor and the founder of an organization called Health Detectives. His work over the past 20 years with challenging patients has led him to embrace a spectrum of advanced healing technologies, which he's going to tell us about today. Welcome, Michael.
Thank you.
Before we go on, I would briefly talk about what I mean by alternative medicine. And by that I mean is any practice that doesn't fall within the realm of conventional medicine, where conventional medicine being a patient sees a medical doctor and is given medicine to cure an illness. Commonly cited examples of alternative medicine are chiropractors, acupuncture, acupressure, homeopathy, eye movement desensitization, herbalism, traditional Chinese medicine, meditation, yoga, tai chi, qigong, biofeedback, hypnosis, and various diet-based therapies. So in a way, it's before there was modern medicine, that's what was there. And now we call it alternative. But I'd like to start by asking you a question. You've described yourself as a wounded healer. Tell us about your own experience of traumatic brain injury and an autoimmune condition. And how did your experience lead you to seek alternative medical care?
It's really a pleasure to be here and to be able to speak of these things. These are two very separate instances, and the rest of my life, I have to tell you, I've been a very healthy person. But in 1975, I was in a very serious automobile accident. My brother-in-law was driving and he was killed. My sister was in the back seat with my nephew. They were both injured. In those days, you could be in the hospital. My sister was for 2 months. I was for a month and a half. So almost everything in my body, every bone was broken. My knee was almost severed. And I flew through the windshield. We were hit twice. So I flew through the windshield twice, and the second time the truck hit, I flew through the windshield and out and landed 30 feet away. So it's pretty significant. But in those days, I remember waking up. What I remember is somebody standing over me and saying, "Repeat these 3 words, red, green Cadillac." And I did, and they figured I was fine. You know, they then just attended to my bones, and at that point I had casts that weighed 70 pounds. But as time went on, I began to realize that my short-temperedness and a lot of things that were going on, my memory, I couldn't understand what I was reading, although oddly enough I was able to understand everything I could read about the brain. Never been interested in that before. So I began to realize that I'd had a head injury. And beginning with the broken bone and the knee and so on, I went from, the doctor told me I was going to be in a wheelchair for the rest of my life. And this sort of began, if I were lucky. And this kind of began I think I'm more charitable these days than I was in those days. I mean, I told the doctor to please leave my room, that I didn't want to spend at that time $400 a day to have to be in the hospital and have to smuggle my vitamins in and have him come and tell me that I would never walk again, and that I would not only walk, but I would jump out of airplanes and land on both legs. And so that began this huge journey of healing and recovery, which it's a long story, but I started in water, and then I had done yoga, I had done Tai Chi, I've been an actress, I was in New York, so I had backgrounds in all of those things. I went to a retreat center in Florida to begin with, and they had never seen anyone come in on crutches before. They didn't know what to do with me. But little by little, I began this journey of healing, and attending to the head injury was more complex because nobody quite knew what to do with me. But it was an odyssey of healing that where I wound up back in California, northern Mexico, and just kind of worked my way through and worked with a number of people, many of whom are real famous today.
So it sounds like you had a combination of conventional medicine and also various different alternative medical health conditions.
Yeah, at that point, you know, I said to you before, I don't care much for the term alternative. I prefer to use complementary or integrative. But I would have to say that for most of that, I had one psychiatrist who I saw when in San Diego, who had written a book called The Psychiatrist and the Guru about Sai Baba, and he was a devotee and a friend of my teacher Indra Devi, who was my yoga teacher. He was very open to the fact that I'd had a head injury because it was so subtle, and he was very protective of me. And I had to go into retreat for about 4 months because I really had a breakdown. I could hardly do anything. And he was very protective of me, but then I felt I had to sort of move on even from that and go along my way. I worked with Moshe Feldenkrais, and that was very helpful when he came to teach in San Francisco. So that was, again, everything I did was kind of a ladder effect. It took a long time before I could really get back to doing some of the things I was doing before the automobile accident. And then in the mid-90s, in the early 90s, I was in another car accident and lost teeth and had implants, and without knowing it, the implants had collagen in them, and that was the only thing I was ever allergic to. It went through my whole system, and my liver enzymes were so elevated, nobody had ever seen anything like that. So that did throw me back into the medical model, but it was a real mystery. And I landed up with a rheumatologist who told me that what he could do for me, we talked about this in the green room earlier with a woman who had done he said he could give me interferon or steroids. And that was like playing Russian roulette. And he told me that he had faith that I would find my own healing, which I said, he wanted me to see a movie called Lorenzo's Oil, where this kid was dying, and their parents, you know, found a way. And I saw the movie. I had to rent it. Friends had to bring it over. I was really in bed for a month. I came back and said, "You're telling me that these are parents that found a cure for their child who was dying. I'm the one who's dying, and you're telling me that I'm going to find the solution." And he said, "I have faith in you." He was younger then, and we stayed around, we stayed friends. But I did, I landed into Chinese medicine, and it was very interesting because I couldn't see, and once I found out, and so by mistake, I called this acupuncture school, who then agreed to see me on kind of a student basis, and when they saw me, they said I was too weak for acupuncture, and they sent me to this fantastic herbalist come from China. But at that point, I found that the liver and the eyes are connected. And that was the beginning of a kind of a love affair with Chinese medicine, which then led me to the practice of Qigong because it was a self-healing methodology.
Tell us about your experience when training to get a master's in psychological counseling, how you were exposed to alternative therapies like vitamin treatments for people who had schizophrenia and so forth. Was this in conjunction with traditional medicine, or?
What happened was I got, it wasn't a grant, it was an internship to work with returning Vietnam veterans in New Mexico. And what happened was that they were all coming in, remember the term post-traumatic stress disorder, they hadn't even named Vietnam syndrome at that point. So they were just coming in and they would say things like, you know, my sister just came up to talk to me and I felt like I was going to throw her against the wall, you know, and they couldn't study and they couldn't focus, they couldn't concentrate. And so they would go to see, I was just there as a person in the education system, and they kind of had to see me because in order to get their benefits. So, but they would start to confide, and they would say that the doctor was giving them Librium and that it would make them very sleepy. So what happened was a friend of mine who was schizophrenic had discovered orthomolecular treatment, and I went and talked to people at the VA about it. He had long-term, very brilliant young man who was doing very well using this megavitamin therapy and a diet. And I tried to convince the VA to try it, and they said Librium is to a schizophrenic as insulin is to a diabetic.
Okay.
So then I went to New York and worked at an orthomolecular institute with some of the very famous people who started it and began to do some research and find it worked.
Well, thank you. I'd like to introduce a video of Qigong warm-ups for elders, and we're going to watch a clip from that video right now.
Nice.
Put your tongue to the roof of your mouth. The fingers are slightly spread. The thumb is separate. Take the hands and place them on the kidneys. Your feet are together. Your knees are pretty straight. Now we begin to rotate the waist. Remember, the waist is the largest hinge in your body. So we're really trying to isolate that hinge. You will feel your shoulders and your hips moving, but try to have the movement start from the waist. And now you can rub the kidneys up and down and side to side. This is a very warming feeling. The kidneys get hot. All right. And now we're going to begin turning in the opposite direction. In Chinese medicine, the kidneys have a lot to do with your basic energy. This is the energy that you inherited. It also rules all the water in the body. And the kidneys work on the bones. Keep the bones from disintegrating.
Okay, Michael, I'd like to talk with you now.
Sure.
I understand that you have a unique approach to alternative medicine when you work with clients that have very difficult problems. Sometimes they come to you after they've failed many other.
Right.
Can you explain to us what it is that you do and what special advantages it has?
Yeah, you know, we look at a multitude of things. Number one, we have to cover the basis with anybody who comes into our clinic. We have to make sure they have the right diet to start with, because if they're not breaking down their food properly and absorbing the rich nutrients that they need, or the amino acids to make the neurotransmitters for their brain, then there's going to be a problem. We want to see, is there any sensitivities or allergies that are showing up that are going to affect that person's health? Is there heavy metal toxicity or certain metals or environmental toxins that could be affecting that person's health? So we have various technologies that are cutting-edge technologies that have spanned 50 years of energetic development, mostly from Europe and Germany, that allow us to not guess, but to pinpoint some of those things I just mentioned. So we can isolate it like a laser and come up with programs for people. And when somebody enters our clinic, people have multiple problems. It's not just one thing. So they're usually with us for about a year, so we can unlayer each of these elements of some of these things that I'm talking about, so they can reach higher levels of health and wellness, obviously.
That's good. Okay, we now have one of your machines here, Michael. Could you tell us about how you use this machine to detect what's wrong with the person?
Absolutely. You know, in Germany, they're very unique in the fact that they combine engineering, homeopathy, electronics, and acupuncture, and knowledge of the energetic centers of the body. And after, again, 50 years of development, they've come up with this machine which helps us uncover the emotional conflicts that are affecting somebody's health. And the beautiful thing about this machine is, number one, it scores. There's a way we hook the person up to this machine, and there's a score we can get on how strong and vital somebody is. That's the first thing we do. Second thing, we can get a score on their emotional happiness. We can actually get a score on that. We can actually get a score on this machine about their cognitive function. And we can also get a score on something called causal. Causal kind of tells us how sensitive that person is. Are they sensitive to taking medications? Are they sensitive to taking homeopathics and nutritional things? Are they sensitive to just the world in general? And the interesting thing about this score is you can have somebody who has a really low score, like 40 or 30, and they don't really care too much about dogs and animals and people, and somebody whose score is maybe 80 or 90, they're just hypersensitive. And that's good to know that. And then from this information, we go this machine. We can set it to what we call the lowest score. Say emotional was the score where they had the most problems. We can set this machine to that, and the person's hooked up to this apparatus, and it's sending out brain waves, specific brain waves, that as I push these buttons here from going from 0 to 10, it adds a tremendous stress on the nervous system until we get what we call muscle weakness or a change in arm length. It's very, very dramatic. And so it's kind of a stress system that gives us a score. And in the time frame that we have here, I can tell you that it allows us to find where in the body the emotional conflict is lodged, what center of the body. For example, if somebody has a problem with expression, it may affect the thyroid gland, or it may affect a gland over the heart. If there's an emotional component that's affecting the heart, it may show up on this machine. It will tell us exactly what the conflict is about, and again, it will tell us it will score the conflict. It will tell us if the conflict is like an 80% conflict. That's huge. It's affecting them in a big way. And the interesting thing about this is where in psychology you know when the conflict is completely zeroed out and gone. This machine will tell us when the conflict has disappeared based on this machine helping us find the exact homeopathic remedy that balances that particular conflict. I mean, that's the short version in the time that we have.
Now, you use the machine to find what the conflict is, and then, as I understand it, that you work with the person to look at their life in totality, like, are they exercising enough? Do they have a good diet? Do they have allergies, maybe, that are problems?
Yeah, this is only one system. We have other systems that automatically, that have been developed, that will scan the body very accurately and tell me what nutritional deficiencies they have, what allergies they have, if they have constitutional weaknesses. So we use that machine. And we use another machine called the NES, it looks at the quantum physics that regulate and control the biochemical reactions in the body. And it shows us where in the body things aren't talking to one another. For example, the heart's supposed to talk to the brain stem, but maybe it's not happening. So it shows us where the body is breaking down as far as information. And so it's information medicine.
Do you find that mental health is often underlies a lot of these problem breakdowns of energy?
In my experience, when somebody's going through our program, most everybody who comes into our clinic has some chronic disease, whether the main thing is coming from depression and anxiety, or it's coming from that they have Lyme disease or they have something else, and with that they have depression and anxiety. But most people coming in my clinic, they have these things. And we notice that when we stack the deck, I call it, and we cover all these things, we make sure they're eating right, we make sure that we remove all the toxins from their system, we make sure that they're drinking adequate water, we make sure they're moving their body, and doing all these kind of things, we seem to get really good results. And if they need some outside care, we're not afraid to send out for people that do things that we don't do, like neurofeedback from Len Oaks, or somebody who's doing EMDR. So we sometimes, we'll use other practitioners as well. But we try and use as many tools as we can to clear, most like I said, the toxins, the heavy metals, and those kind of things, and find the core emotional conflict, because it's connected. What they found in Europe and in Germany is that when you treat the core conflict, it allows the organs of elimination to excrete the toxins. So if you don't do that, and you just go in and just try and do some kind of chelation therapy and different methods to remove these poisons and toxins from somebody, they don't always get out so well, because when you're closed down emotionally, you're locking down the organs of elimination. So you have to do things simultaneously. And that's pretty much
sort of a total plan for the person, for their life, about what they eat, how they sleep, what exercise they do.
It's comprehensive. And we find that if somebody comes into the clinic and they're having tremendous anxiety, we see them quite often. And we see them quite often because they may be ready to take some meds, but they want to try and see if this will help them, or they may come in, they may be on meds, but they're just kind of heading over the edge, when they're really in a bad state. So we have them come in every day, and we have other therapies in the clinic We have Airnergy, which is a type of oxygen they can breathe that relaxes their nervous system and it increases something, 40% increase in heart rate variability. So it allows the nervous system to adapt to stress, and it increases mitochondria energy, the energy that you need for detoxification, for your immune system, for brain function. And so they breathe that, and we put them on a machine that is crossing the boundaries between Western and Eastern medicine. That's the machine called the OndoMed. And they're doing research with depression and anxiety with that. And with that machine combined, we could calm the nervous system down, and we could bring them into a state where they can cope. And we do that every day for a while if that's what they need. We give people what they need, not so much, they have to come in once a month or once a week. So if somebody's going through a tough time, we try and work with them through that. And a lot of times they'll come out the other side, and it'll be in a better state, and they were able to avoid the meds. Sometimes they need it, but a lot of times they can avoid that, and we can take them to a higher level of health after that.
We have now a clip that we're going to show of one of your patients and what she went through. So let's watch the clip.
Dr. Kessler tested me with the Reba machine, and it specifically addresses different emotional components, spiritual components. I have spent most of my life really, really panicked and worried up until about 10 years ago when I started taking Paxil. Even though I was on antidepressants and I was feeling better, the whole panic, worry, fear, since I've been a child, I think, was still kind of harboring down there. And so after being tested with the Reba device and getting on some drops and different remedies, I felt that things have completely and totally evolved in a much more positive direction. I'm much calmer. I feel way less overwhelmed than I did before. Overwhelmed, what's that? Oh, I forgot. I'm not overwhelmed anymore. You know what I mean? I mean, you don't even think about these things. They just slowly disappear. And if I think about that now, it's like, oh, it seems foreign. I didn't realize it, but I slowly stopped taking my sleeping medication until the point where I wasn't taking it at all. And I've been taking it for years. All of a sudden I realized when I went to the appointment to get more that I hadn't taken it for like a month. I didn't even really think about it. So that's huge. I feel like I'm more calm. I'm less likely to get irritated by other people. I kind of just go with the flow more. And in the past, I felt like I tried to kind of manage other people's feelings for them kind of thing. I don't feel like I'm doing that anymore. It's been really great to come and get weekly support, monitoring, make sure I'm going in the right direction with things, and being checked by Dr. Kessler. It's been absolutely fantastic.
Dr. Kessler, could you tell us how you got started using these alternative medicine therapies?
25 years ago, I was an athlete. I was training for the Olympics in judo, and I was banged up. My body was always in bad shape, and I started to see therapists and those kind of things. And I decided that I wanted to go into the field of sports medicine, so I went into chiropractic. And then I got a special training, another certification in sports medicine, had a big center. And I was working on the structural things, the physical things at that time. And I noticed that a lot of patients would come in, and I'd adjust them and do chiropractic, and they weren't getting well. And I started looking at their diets, and I go, wow, this person has they're eating foods that are causing inflammation. They're eating a lot of, I call them non-foods, that are foods that aren't nourishing their body and causing a pro-inflammatory state. So then I started studying nutrition and functional medicine. And then I noticed that people weren't I would reach a certain point of wellness with these folks, but then I said, there's some emotional things in this. Emotional stuff has to have something to do with why they're not getting well. So I started studying neuroemotional technique, which is a chiropractic technique, another energetic technique to access the subconscious brain and find out what's going on. And then after that, I started studying German biological medicine, which is a whole system like I was explaining today, some of these technologies, because I started getting tougher and tougher cases. Really, people are coming in with emotional things, and people are coming in with severe degenerative diseases, and so it's been on an uphill battle, and I'm constantly learning. You can never know enough.
Okay, now I have a challenge to those of you who are watching this on television, and that is, I want you to think of someone that you know, either you, yourself, or someone else, who might benefit from alternative medicine. perhaps in addition to conventional medicine that they might be involved with. And I'd like for you to think of how you can investigate and tell them of some of the possibilities that are available to them. So that's your assignment. Before we end, I'd like to give you some resources and organizations that you might want to get in contact with. Vets organization, the Possible Society of California, is at www.possiblesociety.org, and she has a DVD that you can get, and she also has a program on Warrior's Heart that she's been working with, and
The one for veterans, yeah.
one for
And
veterans.
then Aqua
great.
Chi
Aqua Chi,
for
which is-
women with cancer, and now all kinds of people are doing
Yeah.
it. So Qigong and water.
Yeah, you can learn more about that on her website. And then Michael's organization, Health Detectives, has www.healthdetectives.com. It's in Brisbane, and there's lots of information on your website about the equipment and things that you use and
Yeah.
what you do.
And we'll be having a lecture every other month that they come and listen to us talk about these different technologies and show that too.
That's great. Also, the National Center for Complementary and Alternative Medicine, you can find as a government website, nccam.nih.gov. And there are many other organizations, of course, that, as you mentioned, there are lots of medicines that are involved in alternative medicine. And those, I will put links to those on the website where we're going to have the television show. Thank you, Bet and Michael, for being on the show and telling us about these exciting new possibilities that people have. And I'll close with the words by Reverend Wayne Arneson. Take courage, friends. The way is often hard. The path is never clear, and the stakes are very high. Take courage, for deep down, there's another truth. You are not alone. Thank you for watching. We'll see you next time.